Christy, welcome to Authentic SLP. How are you doing today?
I'm great. Thank you so much for having me.
So glad you're here. Um, so let's just start off and tell me a little bit about you and your journey and what you do.
So I'm Christy. I am the owner of ThriveWell Functional Pediatrics. We opened about a year ago, um, and we serve families to really get to the root of what's going on with their kiddo. The journey that led me here, I worked in the emergency department for about 10 years, and in 2019, I had my second child, so right before COVID. And during that time, he was born with a congenital abnormality that affected his GI tract, and we had to have surgery after he was born. We spent about a month in the NICU, and pretty quickly we noticed when he came home, we were dealing with things
Mm,
like colic and reflux, a lot of things that a lot of families deal with. We noticed some eczema starting. He was on some medication to help, and it didn't really help. It helped a little maybe,
hmm.
and then as he began to get a little bit older, we kept asking the pediatrician, and they just kept telling us, he'll grow out of it. It will be fine. And we started noticing some more things like he was having some vomiting at night. He was having a really difficult time potty training. And then when he started preschool, he was falling asleep at school. He was a really active sleeper, an open mouth breather, very kind of apnea type things going on. And so, with all of those things combined, I started visiting his surgeon and his pediatrician more often. And again, they just kind of dismissed it. It'll be fine. He'll grow out of it. This is just how boys are. And, I just knew as a mom deep down, something else is going on. It just feels like this is more than just something that he will grow out of. And so that's when a colleague of mine introduced me to functional medicine. And thankfully, I was a practitioner and I could kind of backdoor some testing for him. And I ordered at the time, I ordered a gut test for him, and I ordered um, a at-home allergy panel for him. And I found out he has an egg allergy and a wheat allergy. We cut those out. He did, he started to go to the bathroom more normally. And to no one's surprise, his gut was a mess. He had been in the hospital, things like that. So we kind of started on this gut healing journey.
Mm.
And then we got connected with a early intervention airway orthodontist, and he had an expander placed. We did some pretty significant myofunctional therapy to kind of get him breathing correctly at night. And he's truly a different kid. And I just knew at that time when we were going through this journey, it was something that I wanted to offer to other families because I knew that I wasn't the only one who was struggling with these conditions that I was being dismissed by my pediatrician for. And I just wanted to bring that to moms into the community for, more resources for really healing and a place where moms and families really could come and feel heard.
Yeah, and I love that because, I think I don't fault the pediatrician sometimes because they can't know everything, right? Like they have like
Right.
so many kids they have to see and like they just only know what they know and that's fine, that's cool. But when you know there's something wrong and your pediatrician says, wait it out, or they're just boys, like that's so defeating as a mom because deep down inside, like trusting your intuition, like you did. So great thing that you had that medical background that you could actually explore that more. Um,
Yeah, and these are people I want to make it abundantly clear. Like I truly respect his surgeon. I think that she was wonderful, and his pediatrician too. I just think that sometimes we don't value the struggles that families are going through, And when my kid is waking
mm,
up, personally, my kid's waking up 2 or 3 mornings a week and he's thrown up on himself, like that's a big deal to my family. And even though it may not be a big deal to the pediatrician, as practitioners, we really have to value that for our families. Like we have to hold that for them and help them figure it out because it is a big deal.
yeah, yeah, yeah. I think we've all been there when it's like, I understand you're saying they're going to grow out of it, but what do I do right now?
Right.
So, and there's more to discover. So explain to me so you got into functional medicine. So what is functional medicine? Can you explain that?
So functional medicine at its core is really root cause medicine. So it's really a shift from kind
I
of
love that.
treating the
Mm.
symptoms of a chronic illness to kind of digging deeper and figuring out what the cause of that illness are. Treating the symptoms are super important. If we take a kiddo with eczema, for example, um, we don't want them to itch and we want their skin to be clear. But the real question here is why are they having eczema in the first place? What can we do to
Mm.
figure out what the triggers of that eczema are? And this extends to many different chronic illnesses or conditions in kiddos, from constipation, behavioral issues. We can kind of shift that eczema diagnosis to other things, but really it's kind of asking the why and not just the what can we do to, what can we do right now, but also the why behind it all.
And what do you think, what do you think that is kind of missing in traditional medicine, um, that you guys kind of fill in the gap with?
I think it's multifactorial. I think that there's a lot of pressure on practitioners, especially in a traditional setting, to see more patients in a shorter amount of time. So,
Hmm.
we don't get to spend as much time with patients in a traditional setting. Whereas I have the luxury of when I do an intake with a patient, it's about a 60 to 90-minute intake, and we talk about everything from conception to birth. And so we cover kind of that whole gamut of what were the factors that happened even before this baby was born that could be influencing what's happening now. And in a traditional setting, you just don't have the time. And in addition to that, there's restrictions on what you can order, the testing that can be ordered to figure out kind of a deeper cause, um, for those things.
Yeah, definitely. Because there are no other tests that were, I mean, both my kids had like reflux and still have feeding issues and never have they gotten any I saw an allergist and we did a skin
Yeah.
test and a blood test. So I'm sure there's
Yeah, I
other
mean,
things
and
going
I
on.
personally, I mean, from being in this field, I think that a gut test should be a part of every kid's annual or
Mm,
biannual physical. It is that important. All health starts in the gut, and if we can address some of these issues early, they're a lot easier to correct. I mean, with speech, that the earlier the better, right? And it's the same with the gut. We don't, the earlier we can get a hold of these kiddos and kind of help navigate those gut issues earlier, the better outcomes they have. And not to say that it's never too late. It's just the older that you get and the more mature the gut is, the harder it is. And that's with a lot of things.
right. I mean, I see it as a feeding therapist, and I think I told you this when we first met that um, I'm like, keep seeing this thing, especially with kids with ADHD and autism, where they're picky eaters. And then it gets worse and worse and worse and worse and worse, and they're only eating four foods. So I'm like, I know there's something going on. I think I've become a lot more open to different things that I wouldn't have been before because I see it every day, with the kids eating chicken nuggets, pizza, macaroni and cheese, like those four foods. McDonald's chicken nuggets, I don't know what they do to those, but that seems to be a staple.
Are they real?
But
I don't know.
anyways,
I think that may
I
be
don't think so. I
it.
don't think they are, but they'll eat them and then they won't eat anything else. So, anyways, so what do you think? Why do you think so many children today are struggling with chronic issues like eczema, asthma, tummy troubles, behavior concerns, and I'd even put ADHD, anxiety on there as well.
Oh, for sure. Yeah, I mean, I think again it's multifactorial, but I explain it a lot to families as imagining all of our kids or really everyone having kind of an inflammatory cup. And it's kind of our personal capacity to handle the stressors that come into our lives before our symptoms appear. And that proverbial cup gets filled up with a lot of different things. Some things we can control, some things we can't. Environmental factors like toxins and allergens, toxins that we ingest, allergens that food allergies, things like that, stress, and then genetics. And so everyone's cup looks a little bit different. But if we take our eczema kit again, what kind of triggers are filling up that cup to a point that it's then overflowing? And how can we reduce those triggers in the ways that we can to keep that cup from overflowing over and over again?
Mm.
And, I think a lot of what we see now is our families are so busy that we really default to the easiest thing possible. And usually, the easiest thing possible, feeding wise, is ultra processed food, things in packages. And it just creates this environment where our kids are they're overfed, but they have little nutrients in that food. So we get to a
Hmm.
point where, we do have a lot of picky eaters, and what comes first, right? Is this a deficiency that they have, and that's why they're picky eating? We know that zinc deficiency can change the way we taste things. And so, do we have a
Mm.
zinc deficiency that's really causing and propelling this picky eating going forward? Or, is it a sensory problem? Do we need to collaborate? And that's kind of where I like to kind of navigate that with families, because I'm not an island to myself, and I can navigate a lot of kind of the things going on the inside, but I need collaborative care. I need an orthodontist I can send a kid to who's having sleep apnea and not sleeping well. I need a speech and feeding therapist who can help navigate those sensory issues. I need myofunctional to teach a kid, how to swallow properly and how to breathe through their nose. And so I do try to help families kind of navigate those things, because it's rarely going to be just one practitioner that gets your kid where you want them to be.
Yeah, agreed. And we wouldn't know to look at zinc deficiencies. Like that
Right.
we, as a speech therapist, I don't know that. Yeah, that's really interesting. I loved your analogy you explained. I know this is a little bit off, but when you talked to me about like eczema and like PANDAS, about how that cup is overflowing and it can have the same symptoms. Can you explain what that is?
You mean how it can look differently and when it overflows?
Yes, yes. Because I understand
Yeah,
eczema, but I didn't understand when you talk about anxiety, like I could understand eczema because I've always understood that you eat things and then it causes eczema on kids' skin. But I don't understand what, how that relates to same as anxiety or OCD or anything like that. Can you explain that? Does that make sense?
right. So, yeah, so that inflammatory cup that we have, inflammation can look very different in different people's bodies, right? And as that inflammatory cup builds up, the we all have genetic factors that we are born with. And
Mm,
sometimes those genetic factors, when that trigger is pulled by what's happening in our environment, it looks like eczema. But sometimes when that genetic trigger is pulled, it looks like PANS and PANDAS. And it really has to do with what your genetic makeup is. And we can get genetic testing all day long, but sometimes we won't know what that trigger is going to be and what it's going to look like until that inflammatory cup overflows. Sometimes it looks like anxiety in kids, and sometimes it looks like depression. And sometimes those genetic factors, um, we won't be able to reverse, but we certainly can make them better by reducing some of the factors that are causing kind of the inflammation and the irritation.
yeah, so that's fascinating to me that, I understand that how genetics is not a silo, so genetics is also very important to this puzzle.
Oh, for sure.
Um, yeah, so I love how it all comes together. But I would never have thought there could be something in the gut that would cause anxiety, like or that didn't even occur to me. Eczema made sense, but when you related it to everything else, I was like, oh, okay. So that was super helpful. And I just talked to an OT recently who was telling me that when she first started like 20 years ago, she had like 5% anxiety on her caseload. And now she said 90% of her kids are anxiety as an
Yeah,
OT.
there's tons of, not to be too nerdy, but there's tons of new studies that are coming out that really prove that, the more ultra processed foods we eat, the worse our gut is, the worse kids' anxiety is, the more rounds of antibiotics that we're taking. They're a huge disruptor to our gut. And don't get me wrong, I have one foot firmly planted in the conventional realm, and I think antibiotics save lives. But I think that they're overused, and we need to use prescription medications more judiciously to be able to prevent our kids from having these huge gut disruptions where their lifelong health and wellness is in jeopardy. And when we're treating kids over and over again with medications that disrupt their gut, and not healing them in between those times, we really get to a spot where we're setting kids up for, depression, anxiety, for the rest of their lives. And we know what that looks like in adults, right? And so we don't want to
Hmm.
start them off in that place.
Yeah, and I think it's for me too as a professional too, like that OT is in that silo, and she thinks, it's maybe the parents we're being too flexible with our kids. There's too much iPads. Well, maybe, but like, what if there is something else that you don't know about? So you're blaming a parent, and how is that going to make that parent feel? If they're
Right,
trying to be
right.
strict, I know, and I hate that because then I'm like, look, maybe that parent is being strict and have boundaries, but that child is suffering from something else. So again, why it's if you feel like it's not that intuition, that mom intuition of like, no, I am following these things and they're still not getting better, that's a sign that something else is going on. And even
Well, and
psychology, how they
anxiety,
would treat it.
yeah, for sure. And anxiety and depression can very well be genetic, and there's nothing we can do about that particular factor. But there's other factors, again, in that cup that we can reduce. And so even if each one of those is only reduced 10, 15, 20%, we are overall reducing the amount of anxiety that is happening. And so we can control kind of a low level of anxiety, but we can't control a whole cup of it, right? And so I think that's kind of what
Yes.
I like to talk to parents about is where can we reduce the stress? Where can we reduce the exposures? Where can we reduce the toxins that are contributing to this overall inflammation that is causing things to be worse?
Yeah, it's really, yeah, it's really insightful because I think and the reason I'm bringing up anxiety so much is because it's such a big thing. And
Oh, for
I'm
sure.
seeing it so much, and so many of my parents, and like and then diagnoses. So it's always good to rule things out before you go get a diagnosis too. And I think functional medicine is a great place to start because if you can, if like I think too, if my child is going to have anxiety, okay, but if I can, and that's who they are a little bit, that's fine genetically. But if I can help them not be so anxious and make it functionally throughout the day by changing something in their gut or learning more about them, then I'm going to take that route to help them, of
And
course, you know?
And the reality is there will be kids and there will be people who need the medication, but our goal is to have you on the lowest possible dose, right? And so if we have a really good gut and we know that your gut is healed and looks really great, and we know that there are certain strains of probiotics that specifically help anxiety and depression, so we know that
Mm,
those look good, then potentially we could be on the lowest possible dose and have the lowest possible side effects. So that all kind of works together, right? Because, and you could say this for things like ADHD and autism, these kiddos
yeah.
probably will have to be on medications. There's not going to be a time when they can come off all medications, most likely. But
Hmm.
can we reduce the medication load so we're not having so many side effects?
Right. And I think I'm gonna maybe I'll cut this part out, but I think because I work with so many kids on the spectrum, it's like your child's still going to be autistic if they have autism, more than likely. But they're going to be amazing because they're going to be so smart and they're going to be, there's always those great things that they can be if you get them with
Right.
communication. And they're going to be like, there's so many famous people that are on the spectrum. There's a great future. But if we can eliminate those OCD symptoms so they can function, like so they can be functional. So you're
Right.
eliminating those symptoms that are causing them not to be functional. They're still going to be the great maybe little quirky kids, but if we can take away those hard things that they have to deal with every day,
Or
that would
can
be
we decrease
amazing.
stimming? Can we get
Yes.
them to a point where the neuroinflammation isn't suppressing their speech? Can we get them words? Like these are all things that are
Yes.
functionally really helpful in a family with a kiddo who's nonverbal. And can we talk about ways that we can get you to a more functional spot? You're right. Like we're never going to get to a spot where we're going to say we can just cure this with functional medicine. If someone tells you that, it's a huge red flag. But what I want for families is for them to feel like they have more function and their daily lives aren't as hard because their kiddos can communicate to them.
Absolutely. So, and I have had families that have used functional medicine and I have seen an improvement. So, it is a real
Yeah.
thing. You guys have convinced
Yeah.
me, but so I think we've kind of addressed this, but you can go ahead and expand some more. How do you use tools like advanced testing, nutrition, or environment assessment to go beyond just band-aid fixes?
Yeah, so we have access in functional medicine to some testing that conventional pediatricians don't have access to or aren't willing to interpret. So some of those testings are like gut testing. We have organic acid testing, things like that. that we can look into. But once we identify what a kiddo's factor or factors are that are causing this inflammatory cup to be so full, we can reduce those factors in kind of a systematic way to help their symptoms diminish. So if we take the eczema kid, for instance, if we identify some food related allergies, we identify some products in the kid's home that is causing exacerbations, we cut those out and start kind of healing the skin and healing the gut from the inside. Then whenever we, um, whenever this kiddo eats and, you know, is able to kind of heal from the inside out instead of just continually putting steroid cream on, for instance.
Oh yeah. I think I did that when I was a kid because I had eczema. You know, all those things you're like, when I
Me
was a
too.
kid, that and I had it around my nose, and I remember my pediatrician gave me like steroid cream I used like every day. And then I had that like outbreak where my whole face turned like red and then I wasn't allowed to use steroid creams ever again. So been there, done that. I probably
Yeah.
should have seen functional medicine. So I'm so glad it's here now, right?
Yes.
But
Yes.
and then wh so what do you think? I ask this question every time too. Like as a mom, well, first of all, what are three simple things every mom can do to support their child's health from the inside out now?
So I would say my number one is to move from a more processed diet to a more whole food diet. And I know when I say that, there's going to be families who kind of throw their hands up and say, like, I have a really picky eater. That's not happening for us. And I know I have a kid who's a particular eater. So I am very sympathetic. And there are days that you win and there are days that you don't. And that is just the reality. But we have to move from a processed food that has all these additives and even foods that are organic, they're still over processed, right? And they don't look like the original form of what the food was, so their nutrient value is pretty low. And so we have to move from those kind of processed foods to a more whole food diet. And it doesn't happen overnight, but moving that way, modeling it for your kids, is the first thing. The second I would say is kind of starting to take notice how much sugar your kid's eating. Kids shouldn't be getting more than 25 grams a day. And it sounds like a lot when you say it, but when you start to notice each piece of bread has 2 to 4 grams, if you're eating even like the low sugar brands, you look at the peanut butter they're eating, it has sugar, the jelly has sugar. So just kind of noticing how much sugar your kid is eating and trying to lower that to that 25 gram spot. And then paying attention to their sleep. I would say that those are my top three things, even if you don't want to move into like a functional medicine practitioner, those are probably the top three things that can make a huge, huge difference in families' lives.
So explain to me, because the sugar thing, I'm fail there. So explain to me why sugar is bad or not good for them or good stuff.
Sugar disrupts the gut microbiome and it feeds the
Mm,
bad guys. So whenever we talk about your gut microbiome, we talk about good guys who are kind of our commensal bacteria who produce the good things in our gut. So short chain fatty acids, they ferment foods in our gut. They make the chemical signals that talk to your brain. And then we talk about the bad guys. And when we talk about the bad guys, those are kind of the overgrowth of bacteria. The bacteria is supposed to be there, but when it starts to outgrow the good guys, then we start to have this imbalance where we see a lot of inflammation. There's only a single layer between your gut and your bloodstream. And when that single
mm,
layer of cells gets broken down, then the food that is in your gut starts crossing over into your bloodstream, and that's when we can get more food intolerances. So you've probably noticed kids who have didn't have a food intolerance, and then all of a sudden they're allergic to gluten, they're allergic to
hmm
all kinds of stuff. And when your gut, the lining of your gut isn't keeping all that food inside where it's supposed to be, it can be exposed. And then your body will create a
mm.
response to it. And so that's really why we want our gut to be healed. That's really why we want those junctions to be super tight, and so sugar disrupts that, and it feeds the bad bacteria to make it even more prolific.
Okay, that makes sense. I got that now. Now, when it comes to sleep, this is because I hear all this time. I agree with you because we do myofunctional therapy, so or facial myofunctional. I get it. but this is what I hear from parents all the time. But my kid sleeps from 8 to 8, great, or like 8 to
Yeah.
10, or wait, no, 10 to 8, or something like that, or seven
Yeah.
to seven. They eat 12 hours. They sleep 12 hours a night. They're fine, right? What would you say?
I would say it depends on what kind of sleep they're getting, right? I had a kid who was
Yes.
sleeping 12 hours a night and he was falling asleep at preschool at 10 a.m. And so I think that you really have to pay attention. I think that you have to watch your kiddos sleep. And this is not my area expertise. I certainly talk to parents about it. But one of the things I ask every family I meet with is, does your kid open their mouth when they sleep at night? And if the answer to that is yes, I ask them, are their baby teeth very close together? And those are kind of two indicators to me that they probably need to see an airway specialist. And the person that I see here in St. Pete that I refer a lot of my patients to, he'll see them as young as 3, and he'll put expanders in to get them, to get them
Their palate
closed mouth
open.
breathing at night. Yeah, because we know that whenever, and you can probably speak more to this than I
Yeah.
can, but when we close our mouth at night, we get deeper, more restive REM sleep. And so the goal is for us to be closed mouth breathing through our nose, and for the palate to be wide to allow for that. And my kiddo had a little bit of a different situation. He was born with kind of a congenital abnormality that caused a narrow airway. But if you start looking around and you start noticing, most kids have pretty narrow palates. Most kids' baby teeth line up and they're very close together. And to me, that's always an indicator that they may need some palate expansion at some point.
Yeah, and even at a young age, though, not always. Sometimes we can get palate expansion through myofunctional. Not always, but
Yes,
if you don't
yes,
want to go through a palate expander first, you can always do myofunctional. And second is, again, adenoids tonsils are always a thing too. So I would always get those checked out because if your adenoids are blocking your airway 90%, you're probably going to sleep with your mouth open and you're probably not going to get good sleep. One thing I always say to tell my parents too is just like, and I think this clicks with everybody. Do you know when you have a cold and you can't sleep real well because your mouth is open? That's how your kid feels every night. Do you wake up feeling refreshed? No.
yeah. Well, and I will say that there is some evidence too, and I'm sure that you know this. I think we kind of talked about this when we first spoke, that palate expansion, myofunctional therapy, healing the gut, getting the oral microbiome back in order, all these things can decrease the size of the adenoids and tonsils. So they may actually
Yes.
not need to come out. That's not always the case, but there are times when that can be very helpful. So if your kid is facing a TNA, and that's not where you want to go with them, you can always address it from a functional standpoint and see if your kid is one of those kids who they will come down in size, if you address those, kind of those
Yes.
fundamental things.
Yeah. Um, Yes, absolutely. And then a lot of my families don't want to go to ENT and get their surgery. So this is another, I always say there's other options that you can try first. So
Yes.
this would be a great
Hmm.
other option to try. Side note, when you were talking, what about drooling? Kids that drool. Any idea? Because I've had a kiddo where I was like, wasn't adenoids tonsils, it wasn't fun, oral motor skills. Any ideas of drooling? We get that more and more of that now.
Yeah, I mean, I would say that it can be, I, the first thing that kind of comes to mind is like, what are they eating? How are they eating it? Um, do they have like overall low tone? Not low tone like in their mouth, but is there like a low tone going on somewhere else where they're having difficulty like closing their mouth whenever?
Mm,
Yeah, so I don't know. It's hard to say always for sure because each kid is kind of unique, but could they be teething? Could they be, other things like that going on? So yeah, it can certainly, there are a lot of reasons that could be happening, but those are the kind of things that come to mind
yeah, yeah. I was just thinking if that could be gut related because I hadn't
for
ruled
sure.
that out with the family, and I was like, oh wait, maybe that's what I'm missing. So that's
For
good to
sure,
know.
because I mean, the oral microbiome is the first interface to the world, to our body, like from the world, right? Like the things go in, and our oral microbiome is just as important as our gut microbiome. And I know, when kids are eating ultra processed foods, we know that that oral microbiome is not optimal.
Okay, so that makes sense. Yeah, I didn't think about that what you just said about the oral microbiome. See, this
Yeah,
is why we
it,
all need to get together.
I know. And it's really interesting because, and again, I'm not an expert in this area, but whenever I'm talking with my friends who are dentists and, I'm at my kids' dental appointments, I'll talk to them about different toothpaste. Like, what do you think about this? What do you think about this? Are we doing like, talk to me about the fluoride. What are we doing here? And I always want to learn. I want to learn. Things are evolving, and I want to know about them. And so one of the things that the at our most recent dental appointment, the dentist said to me, which I found super interesting, and it makes perfect sense, is that the the way that you keep your mouth the most healthy, the way that you prevent your kids from having dental caries and problems with their teeth is not always necessarily brushing, it's their diet. Most of it is your diet. Now, brushing is super important, flossing is super important. I don't want to take away that, but a majority of it is the food that we're putting into our body because it affects the oral microbiome and the good guys and the bad guys that are in our mouth, just like in our gut.
Awesome. I have uh, two children with lots of cavities, so every time their dad asks, "What do we do to so besides brushing?" So that's great. Great to hear.
Yeah.
So, hey, so how if I am a mom looking or a dad looking for your services, how can we find you? Where are you located? Tell us about your practice, all that.
Yeah, so I am telemedicine in Florida. So I meet with all my families virtually. And it works out well because a lot of times by the time a kiddo has gotten to me, they've had a lot of workup. They've seen a lot of specialists typically. So I love to see all of that. I love for moms to bombard me with all their labs and all their things. I want to know everything. And I like to, help them put the pieces of those puzzles together. So my website is thrivewellfunctionalpediatrics.com, and you can also find me on Instagram at thrivewell underscore functional underscore peds. So I post there, and then I have some blogs on my website as well with some recommendations for like some hot topics I'm asked about a lot. And I have a newsletter that goes out from time to time. So yeah, all
They can
all
sign up
those
for that.
places. Yeah.
Awesome. And I'll make sure I put that all in the show notes too, so people can find
Okay.
you. But
I
yeah,
also have a
we just
discovery call if anyone's interested. You can book a free discovery call. We can see if we're a right fit for one another. You can ask questions, and we can kind of talk about how I can help your family.
I love that. Because I have recommended a lot of people to come see you. At least do a discovery call because I feel like if I would
Oh,
have known
yeah.
this at early question, this side note, what about I know infants is really hard because their biomes are. Do you help with infants and maybe moms
Yeah,
who are having trouble with? You do?
I
Awesome. I
do.
don't know who.
Yeah, yeah. So, I mean, I would say that this kind of ties into like something that I'm really passionate about. One of the things that I wish that was talked about more often was the first 1,000 days of life. And this was not something that I even knew much about um, until the last couple of years. But the first 1,000 days of life is from conception to age 2. And we know that that period of time is crucial for laying a firm foundation for a good, healthy microbiome. And that can last you throughout your life. And so I would love if practitioners talked more to our pregnant moms or our moms trying to conceive about their nutrient deficiencies, about their gut microbiome, and about what they can do to kind of lay this foundation. Now, there are moms who will not be able to have a baby vaginally, and that's okay. But we do know that their vaginally born babies, their microbiome looks very different than a C-section born baby because when babies are born, they breathe in a little bit of mom's poop and it seeds their microbiome. And that is really important. But when a baby is born via C-section, they breathe in the operating room and their gut microbiome looks very much like the operating room bugs that are around. That can be corrected, but it's important that you kind of know that going in. And so you can help your
Mm,
baby's microbiome not be overrun by these kind of bad guys that are in the operating room. You want their gut to look more like yours. And that can happen through several avenues. But I wish more practitioners talk to moms about that because it really is important. And even a baby that's not born via C-section, if mom didn't have a particularly healthy pregnancy, or maybe her gut microbiome isn't great, um, we still can help that baby's microbiome look healthier, as they get older. And you're right, the baby's microbiome, it's important not to mature it too fast. So it is important to work with someone who knows what they're doing whenever you're working with a baby, because if you can't just give them kind of like any probiotic, it has to be very specific to babies, because if their gut microbiome matures too quickly, that can be harmful as well.
Mm. Yeah, because I can't tell you all of the moms that I get. Well, so advice number one would be if you're planning on having a child, come see you, right? So you can get your
Yes, I would love
biome.
that. Yes.
And then second would be when you have your baby, no matter where C-section or vaginal, definitely C-section see you. But if your baby's having trouble with reflux, they should see you, right? You could help
Right. And
maybe.
like there's some early symptoms. Like if your baby has started eating and their stools have not firmed up and they're continuing to have super, super loose stools, that could be an early indicator that they have some sort of intolerance happening, or maybe their gut isn't exactly right. If they're having any sort of skin issues, so like the chicken skin on the back of their arms, eczema, rashes, on their faces, the skin is really a window to the gut. And so we know that any of these skin disturbances can be also early signs that something could be going on. So just recognizing kind of those early symptoms, of course, reflux. Reflux is a huge one, and it's so hard on families because when a baby is crying all day and all night, and there's nothing that you can do to help them, and you're trying to nurse them, you're trying to bottle feed them, you're trying everything that you know to do, and no one will help you, it is so, so difficult. I mean, you're already in a time where you're getting very little sleep. And then on top of it, you have a baby that's just crying all day and all night, and it can be really, really tough on families.
Absolutely. And that's why I'm like, I need help with that because I see the struggles and I don't have anywhere to send them. So if there is somewhere that can at least help them prepare them, plus if they are going to have gut issues in the future, let's stop it or get a plan or get them settled with a functional medicine doctor now so that as they grow up, they can not have those four foods they only eat.
Yeah, and there's some really simple things that pregnant moms can do. We know there's a really well-studied probiotic called Lactobacillus GG. It's in Culturelle, it's over the counter. We know that moms who take Lactobacillus GG before they have their baby, so in their third trimester, these babies have a significantly reduced chance of having asthma, eczema, allergic rhinitis, all the allergic diseases. And so it's just so simple. The risk benefit, there really is no risk there. And so we just, it's these kind of little simple tweaks that families can make and that pregnant moms can make to really ensure that they're laying a good foundation for their baby at birth.
Yeah, because you just don't know what you don't know. Like, I wish I would have known that. So now you have an opportunity to know these things ahead of time, which is just amazing and so needed. So I'm so happy to that other people will know about you and in Florida because I know so many people and me as a mom, I would have and still
Yeah.
might contact you about helping our kids,
Okay.
but both my kids have reflux and it was hard. Reflux.
Yeah, and
I
I'll
could
say the other
say it
thing
right.
that families really, really struggle with is kids getting sick really often. That's another thing that we see a
Yes.
lot. My kid is sick all the time. And the other thing that I would love parents to know is that almost 80% of your immune system resides in your gut. And so we have these really cool little tissues in our gut. They decide who's friend and they decide who's foe, and so they are able to respond appropriately when our gut is optimized. When it's not and they over respond, then we see things like chronic inflammation. We see things like autoimmune disease, and when they respond too little, we see kids getting sick more often and for longer periods of time. And so we really want, again, just to drive home this fact of a healthy gut microbiome not only keeps your kids from getting like super ill with chronic inflammatory diseases, eczema, asthma, things like that, but also just from a day-to-day basis, keeps your kiddo from getting sick so often. And I know all of us can benefit from our kids getting sick and being out of school more often.
Yes, yeah, that is a big one too. So, well, thank you so much for your time. This will be super helpful. I know so many people that everybody can benefit from this. Every parent, yeah. So, super excited about sharing this and all of the people that we can refer to you because
Thank you
we
so
don't live
much.
in a
Yeah, I really
silo.
appreciate it.
So,
I know, and
all right,
I love collaborative care. So
yeah,
it's
that's
always
great.
nice to meet like-minded practitioners who were able to kind of help as one because you're right, like you don't live in this silo and patients really benefit when practitioners work together.
Absolutely. Well, thanks for your time, and I will be seeing you later, I guess.